on Clomid, that they start a certain day of their cycle, and that helps the Graafian follicle to develop better. And then they will give the person a shot of HSG to stimulate ovulation on a regular basis, so it will be timed. And then that will help, hopefully with fertilization with normal intercourse, okay? Controlled ovarian hyperstimulation. ART can cause ovarian hyperstimulation because if I'm giving my patient infertility drugs to cause the Graafian follicles to be increased in number or increased in size, then I have an overabundance of a gonadotropin. Which gonadotropin is going to be elevated? FSH, because that's what the Clomid does, is it stimulates the ovary to put out FSH, okay? It triggers the brain, the anterior pituitary gland, ovaries, okay? So it triggers the brain. I need a gonadotropins. Those gonadotropins are FSH and LH, okay? But since the LH is not part of that, they give you an injection of HSG, and that triggers the Graafian follicle to let go of the cumulus oophrus on its own. Ovarian hyperstimulation. More than likely, we're going to stimulate the ovaries to build more follicles. To build more follicles, you need FSH. And then they will go in and retrieve those cumulus oophrus, which is part inside the Graafian follicle, okay? Now, what that causes is the ovaries get really, really big. So you can get really, really tender. You can even build ascites and a pleural effusion because of the thecalutean cyst on the ovaries. Thecalutean is a Graafian, a corpus luteum, but it's both sides. Okay, a thecalutean. And we get thecalutean from, on a normal pregnancy, you can get it because your HCG is too high, like carrying twins or triplets. Or I have gestational trophoblastic disease. I have no baby in there, okay? So I have really high numbers of HCG, okay? But now because they're giving me Clomid, and that there's one other drug that they give you. My ovaries are very large. They have multiple follicles on both of them. And they're gonna make an appointment for them to be aspirated so they can save those. Okay? They can use them immediately or they can freeze them, okay? Now, if I have ascites, pleural effusion, and ovarian mass, what syndrome do I have? Meigs syndrome, okay? That's part of it. If it gets bad, they might even have to do a paracentesis. What is a paracentesis?
They take the fluid out.
They take the fluid out of the peritoneum, okay, because of the amount of ascites. This chapter was hard to read because of all the abbreviations. Okay, embryonic transfer. Embryonic transfer is ZIFT, okay? Because ZIFT, you already have an embryo. You already have a conceptus. Okay? Now, ZIFT, it could either be a conceptus, just a zygote, or it could be a blastocyst. Now, a blastocyst occurs 5 to 7 days after fertilization. Okay? So they can insert that into the endometrium and let it implant on its own. Sometimes they'll implant it into the fallopian tube and let it keep dividing, and be inside the endometrium so it can implant on its own. Okay? Intracytoplasmic sperm injection. That's where they put it in a petri dish, they wash them, they clean them, and only the strong survive. Okay? Because some of them aren't good swimmers, and some of them are very good swimmers. Okay? So what they do is they take the slow swimmers out. They only inject the most fertile or the most active sperm. Has anybody ever done a sperm count in here? Okay. So you put a drop of semen, onto a slide. That slide has a graft. It's like little boxes, okay? You pick one box and you have a counter and you look through the microscope and you count how many sperm are in that box. And then you multiply that by the number of boxes. It's pretty cool. Cool. And they really do look like the pictures. They have like a little whip tail on them. Okay, so they can take that sperm and they can inject it into the vagina. Who watched My Baby's Mama? My Baby Mama, or what is that one? Oh, it has that blonde-haired comedian in there, and her boyfriend wanted some extra money. Yeah.
It's a movie.
Yeah, it's a movie.
Yeah.
I can't remember.
Mama,
I think it's called Baby Mama. And so anyway, her and her boyfriend decided to scam this couple, and her and her boyfriend had sex, and then she put it in a turkey baster and was in the bathroom and trying to insert it into the. It's great. It's a crazy movie. If you ever get a chance to see it, it's really, really funny. Okay. In vitro fertilization is that where they can take the sperm and they can take an ova and they can put them into the fallopian tube and let them impregnate themselves. Okay? Ovarian induction is a form of Clomid, where they give you the injection. You take the injections on certain days of your cycle, and it's supposed to make more follicles. Okay? And a gift. That is where you have the sperm and the oocyte into the fallopian tube and they impregnate themselves. A zift. They've already impregnated an egg with a sperm. It's already started dividing, and they can insert that embryo or a conceptus. It's a zygote, and then a morula, and then a blastocyst. Anytime during that time, they can implant that into the fallopian tube, and it can implant itself into the uterus. Every time you look at an ovary, on an ovary that is hyperstimulated, you have to count those follicles. Okay? I was reading in the book, and they're not doing it like they used to. They've kind of cut down on the amount of ultrasounds that they do, but ultrasounds is the main conceptus, the main imaging for infertility. Oh, that was her coming in. Was it? She waved? Is it too hot?
Yeah.
That's why we're switching.
But you don't think this will be harder with the windows and everything?
Because it's,
I like my windows.
in this room and it's smaller. You wouldn't.
No, it's the same size.
Oh, it's the same size?
Mhm.
The windows?
Mm-hmm.
When did they get?
I think in the summertime, they're gonna be hotter than what they think that they're going to be.
Why don't they bring a fan?
حطوا في رمضان يعني.
Yeah, they have fans in
صعب.
It's just that hot.
صعب رمضان صراحة.
Okay,
شهر بالسنة تفكر برمضان.
okay, so. I'm willing to try anything that they want me to try, so I'll just go from there. What? Right.
Oh.
You see that? Mm-hmm. It's not very good. That's good enough.
هذا امتحان ما يدري. لا هذا شيء ما عندناش امتحان. هذا مشكلة عندنا. احترام اللي سنها ما واحد يحترم.
Okay, here's my uterus. Here's my endometrium. Okay. If it's midline in the canal, that's called a pseudo gestational sac. Okay? Pseudo gestational sac. Okay? Because a normal gestational sac is going to be in the endometrium. Okay? It's going to be inside the endometrium. Gestational sac. We call it a gestational sac. It's called a chorion cavity. Extra embryonic chorion. Close enough. Okay? We call it a gestational sac. Okay? But really, it's a chorionic cavity. Okay? So the first thing that we're going to see inside that chorionic cavity is a yolk sac. Yolk sac. We see this around 5 weeks. We see the yolk sac around, sometimes we can see the gestational sac 3 to 5 weeks. Okay? We always see a yolk sac by 5 weeks, 5.5. Because the heart starts beating at 35 weeks. Okay? 35 days. So that will be considered a crown rump length. Okay? When we first see it, it's just 2 little cells beating like this.
I saw it.
Did you see it?
My first time.
Yeah.
Tuesday.
Yeah. It's pretty amazing.
It was.
Okay. So let me talk to you about the pseudo gestational sac. If you see a pseudo gestational sac, you have an ectopic pregnancy. Okay? If you see a pseudo gestational sac, you have an ectopic. Make sure you pay attention to the adnexus. Okay? That ectopic can even have a heart rate. So be very, very careful, because depending upon where the ectopic is, like if it's in the cornua or the interstitial part of the fallopian tube, what happens?
PAD.
Nope. The mother bleeds to death. Okay?
What's that called?
Death.
They're not
If you do not have a pregnancy in the fundus of the uterus, it's an ectopic. Okay. If you have an ectopic in the infundibulum, or I mean in the interstitial or the cornua part of the uterus, or the cervix, okay, automatic hysterectomy or death. Okay, so your life, I mean, you've got these women's lives in your hands. Okay, yes.
Can you,